This is BoomerLife on CL 650.
I'm so tired, I haven't slept a wink. I'm so tired.
I think you're sleepy listening to that.
I know.
We're speaking with the SnoreDentist, Dr. Charnel Muir, on BoomerLife, and there's a lot of boomers listening to this who snore or have a snoring person in their life. Now, you are based in North Vancouver, but you do travel around the Lower Mainland and the island. So explain how that works.
I do. So once a month, I am over on Vancouver Island, and I see patients everywhere from Victoria to Campbell River. I'm in several locations for one day during that week, and then I have support staff in those locations. So we treat patients over there, and then my main office, as you indicated, we're in North Vancouver at Marine and Bewick, and then once a month I do head down and see patients down in the West Broadway corridor, and then depending on demand, I will go out to the valley and see patients in Abbotsford and or White Rock.
So someone, say, listening on the island who's interested in this, so how would they find a clinic where you might be going in the near future? So can they go to your site first? Is that the best way?
So the best way to get a hold of me in any of the clinics is to get a hold of me through my website. So there's an email on the website, the info@snoredentist.ca. And just fire me off an email. Let me know what you're interested in as far as location. And then I can get you scheduled in, or I will schedule you in myself. And so I'll look after anything like that, or I'll direct you as to where you call or contact to get an appointment.
Okay, so someone is going to visit you and make an appointment and get assessed. So what do you do? I want to get to the kit here in just a moment, but sitting in the chair for the first time, what are you doing?
So basically, you know what? My first appointments actually are just knee to knee, and we talk to each other.
Okay.
I will do a brief exam in the fact that I have to have a look around to know if I'm dealing with anything anatomical that might need a referral back to your physician, like large tonsils or anything like that. I need to know what you have in your mouth for crowding and structure. But that's all just aside at this point. Our first thing is to actually just figure out what your symptoms are, what brought you in, and what we need to do next to help you.
And how do you do that?
We ask questions, and we send home one of these home sleep monitors.
I mentioned it in the break, and you pulled it out. It looks like a lunch pail for a kid in grade 2, but it's a... What is it?
It is. Actually, the monitor itself comes in a different packaging. Okay. And we switched it to these packaging because of the fiber optic cables. And the one that it comes with is very small, and it was easy to damage the monitor by putting it in.
Right.
So these literally are insulated lunch kits.
Oh, is that what it is?
Yeah.
Okay.
And we have blue and red and black.
Oh, nice.
But they're all basically the same. And we just use it because it gives the monitor more room and it doesn't get damaged.
Okay, so I'm going to describe it here. For those, we do have the video available, but so what is it? It looks like a cuff.
So this is, the first part will be this, there's going to be an effort belt.
A belt that goes around your chest,
That's right. And it's a stretchy belt, and it's a Velcro belt. So basically, you're going to put it around your rib cage. The monitor is going to go into the middle of your rib cage, right at the base of your sternum. And then you do this Velcro belt up around your rib cage snug enough that when you lift up your arms, it doesn't fall down. So what we're looking for is we're going to pick up the expansion of the ribs as you breathe. So every breath, it will count, and it's monitoring that you're breathing consistently throughout the night. Now, I always tell everyone, you wear it over a T-shirt. You don't wear it on bare skin. Not that you can't. It will work on bare skin, but could you imagine the Velcro belt pulling out one hair a minute all night long? Not very comfortable.
Would that register on the monitor? Yeah,
That's right.
So you're not sleeping.
That's right. You're not saying, well, I don't know why. No, so it's got the effort belt, and then it's got a finger probe, and it comes off of the effort belt. And the finger probe would be like any oxygen probe that you've seen in a hospital, in a movie, on Hollywood.
So you're just sticking your finger in.
Just going to stick
like a rubber glove.
Like a rubber tip glove, and it's just going to go on the end of one of your fingers, and it's going to monitor things like heart rate and blood oxygen. So it's got a cable that comes out from the belt and it goes to your finger. And then the last part looks like an oxygen cannula. So you've seen people that have had oxygen on, they'll have those two little prongs that stick in their nose. And so, but this doesn't blow oxygen. This is just going to pick up air in and out.
So pressure.
So it'll pick up pressure and it'll pick up that kind of flutter. So we're looking for those snoring flutters in and out. So some patients that only mouth breathe and snore, they can fool the machine a little bit with this because this is only picking up nose air.
Now, this is intriguing to me because we had the doctor on from the sleep clinic at UBC.
Yes, Dr. Fleetham.
That's
probably.
right, Dr.
Yes.
Fleetham, that's correct. And he said in the old days, he used to have to sit and listen to tapes of snoring.
Yeah.
And now you have this.
Now we have this. Now we can actually monitor the airflow itself. Now, if you were to go for, this is called a level 3 sleep study. So there's 4 levels. The level 1 is when you go to the hospital and have one. And
that's the one he has at his clinic.
Right. So we have almost all of them in the province are hospital-based. We have 3 now that are non-hospital based, but they all are run by physicians, and you go there, you sleep overnight in the facility or the hospital, and this is the cut-down version of that. So this is 3 of the 12 or so things that they measure.
Sure.
So they also do brain waves, because we actually don't know you're sleeping unless we measure your brain waves, right? So they do brain waves and leg movements. They have a second one that does the mouth air instead of just the nose
Probably
air.
cameras too.
Yeah, they have cameras. We're watching for people that go thump and bump in the night. We're watching for all sorts of sleep disorders. This is only measuring breathing.
Now, I think it's fascinating that you have a home kit like this, but there must be some resistance to wearing it. I mean, is it going to be comfortable? Can I get to sleep? Am I going to be able to stay to sleep? Because you must have some people say, well, I didn't get a good night's sleep because I had all this stuff on, right?
That's right. Very common.
Yeah.
We'll often we'll ask you to fill out a diary, and I'll often get in the little note section, performance anxiety. I was worried. I was worried I wasn't going to do well enough.
Couldn't get to
I was
sleep.
a test, yes. So you can actually do a second night. Sometimes there is that first night effect. But you'd be surprised at how much people do sleep with it on. And we really only need 4 to 5 hours. So, if you had it on for 8 hours, but you were awake for 2 or 3 during the night, we just ask you to let us know what hours you were awake so we can cut that data out, because clearly we're not going to measure your snoring and sleep apnea while you're awake.
Watching a movie,
TV.
yeah. Now, have you ever tried this?
I have.
Okay, that's good, because I went to my doctor and she wanted me to get the 24-hour blood pressure monitor. Have you ever had that? And I said to her, have you ever tried this? She said, no. I said, yeah, well, I think every doctor should, because that's the most uncomfortable thing
I know.
to wear all night long.
I not only have tried all the monitors, I've also worn most of the appliances that I use. So the monitors I have worn because I wanted to fully understand what the patients would feel like. But I'm also the guinea pig if we have a software issue. So if we have an issue with a monitor and we're not getting data through it, or something happened with the reading and it didn't...
It goes to your house.
I get to go.
Yeah.
I get to take it home and wear it that night. Yeah.
So what are you looking for once you've collected all the data?
So what we're looking for are snoring events, position of sleep, blood oxygen, heart rate, and any sleep apnea events. So basically, they're trying to breathe, but there's no airflow. And those are the things that this monitor will measure for us. Yeah.
And it's quite accurate, I'm guessing.
The more severe you are, the more accurate it is.
Right.
Yeah.
It's the subtleties that are hard to pick up.
Yes. So the more minor or the milder the condition, then the harder it is to pick it up. Clearly, people that have a lot of insomnia and don't sleep well in the night, it's less accurate because they're awake for a lot of the night, things like that. It certainly has its limitations, but for the vast majority, it's sufficient.
Is there a cost to this?
No, we do it no charge to the patients.
Wow.
Yeah.
Because I know, having had the blood pressure one, they charge $50. For the medical lab to get it for the 24 hours.
That's right. No, I actually incur that cost myself so that the patient can get the information that they need so that then we can decide what should be their therapy.
I'm sure there's people who want to know the results the next day.
I know.
So what's the timeline between going for the consult, getting the test, and then coming back to get...
Usually about 2 weeks.
2 weeks, okay.
Yeah.
All right. When you get somebody in and you have to tell them, listen, this is where you are on the scale, where do most people fall? Is it about a third of each that are third are snorers, third of sleep apnea, third that have some other problem?
Probably half of my patients are mild, moderate with some snoring. About another of the other half, about half of those, so 25% of my patients are snorers only, and the other 25% will actually have severe apnea they had no idea they had. So vast majority of the people we catch are in the mild to moderate stages, because that's often when it's either becomes so disruptive at home that they are forced to do something about it, or it's affecting them enough that they start doing something about it, like they're tired.
That's what I was going to say. What is the trigger that finally gets somebody to come and visit the SnoreDentist? Like, what is it? Is it the spouse, or is it their lack of well-being during the day?
About 50-50.
Yeah.
Those are the two driving forces that I see in patients all the time: disruptive snoring or unexplained fatigue, we call it. I'm sleeping 8 hours a night and I still don't have any energy during the day. And my doctor's already ruled out anemia, and they've done the blood work and they've checked me over and my thyroid's fine. And there's no other reason why I'm fatigued that they can find.
And this is a gradual decline, or can some people fall off that fatigue or the energy level quickly over?
Usually gradual.
But that's the problem. It's just, I'm just getting older.
That's it, right? I'm just older. I'm just, I'm not
an excuse
20
for everything
anymore.
Yeah.
Yeah. So people can excuse their way into letting it drag out for a long time. Or people will not want to come in and get tested or mention it to their doctor because they're worried that their only treatment option will be a CPAP.
Oh, that's great that you bring that up, because I want to touch on what are the remedies for people who have sleep apnea and how successful this is in comparison to maybe the CPAP machine. We'll pick up our conversation. We're speaking with the SnoreDentist, Dr. Charnel Muir, based in North Vancouver, but also traveling around the Lower Mainland and the island. We'll find out more about sleep apnea and the SnoreDentist next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.